Welcome to an introduction to the Scrawl COVID-19 platform. My name is Stephen Winters, and I'll be introducing you to a broad overview of the COVID-19 platform through a brief demonstration. Scrawl is a documentation and workflow management tool to help doctors and nurses handle increased patient loads. It puts the thinking of senior clinicians into the hands of junior doctors and redeployed staff. It also provides a live dashboard to manage patient flow and minimize exposure risk. This provides complete information across their medical unit or hospital, all in one place. Scrawl is served as a web application that is installed locally on premises, so it can be either accessed through a bookmark link or via the hospital intranet. Scrawl can be deployed on an internal hospital server that provides the necessary data protections for the clinical information and its users. Scrawl is designed to support clinicians performing critical functions in the day-to-day clinical setting, such as guided assessments, clinical documentation, and the prescription of best practice. It also facilitates service overview for clinical leaders through dashboards and access to clinical data. Scrawl guides a clinician through each clinical encounter, capturing essential clinical information ready to transfer to the EMR. It also collates the information in a dashboard that allows senior clinicians to have a clear oversight of the state of the service and review the quality of patient care. A rapid assessment covers off the major key issues and allows the doctor to commence their workup. A full assessment captures detailed information and investigations. These targeted but standardized care plans allow for rapid decisions on the appropriate patient pathway. Here is a sample of a proposed clinical workflow in the early stages of a COVID-19 deployment. I'll now step you through how to do a rapid assessment. Notice that this assessment has been already pre-filled for a patient who has already passed through the emergency department. Note that the patient's details have been anonymized. The rapid assessment consists of broad categories of a rapid assessment. In this situation, because it is a possible COVID-19 case, the broad headings are listed as below: contact and droplet precautions, symptoms, including that of a respiratory or an infective nature, as well as additional symptoms, exposure risk, high-risk comorbidities, premorbid function in the form of exercise tolerance and frailty score, vital signs, and a targeted exam, including positive and negative findings. In this situation, the patient has had the provisional diagnosis of infective and respiratory syndrome without any respiratory compromise, but due to high-risk comorbidities, the patient needs to be managed differently. The key points section allows them to add additional comments in relation to the diagnosis, because often it's slightly more complex than a classification. Once selected, a diagnosis will have with it the appropriate list of management plans that allow the doctor to adequately document a structured and systematic plan for treatment. Notice that the rapid assessment module allows for a rapid assessment to be performed. It's very systematic and very comprehensive. Once the assessment has been performed and all the relevant boxes have been ticked and the text entered, Scrawl will then produce a clinical progress note that can then be exported into the electronic medical record. I'll now step you through a full admission. Again, with the same principles of ensuring that the full admission is a rapid, systematic, and comprehensive. It merely takes a rapid assessment and turns it into a full medical assessment, generally for the purposes of admitting a patient into the hospital, whether that be the ward or the intensive care unit. The full admission is laid out very much like a standard medical admission would be performed even without an electronic medical record or a clinical support system. Beginning with the clinical history, we have the presenting complaint. As you can see here, background allows you to rapidly document comorbidities, relevant medications, social history, vital signs as part of a clinical examination, including cardiovascular, respiratory, abdominal, and a targeted neuro exam. Investigations can be documented here, and the results can be added into the admission. And again, just like the rapid assessment, the working diagnosis can be selected, and that provides a list of management plans that are specific to that diagnosis. And in this situation, this patient was admitted under respiratory medicine with the following management plans added to the final note. Notice here that under active issues, high risk of COVID exposure has been added. And so while this patient likely has an exacerbation of her asthma because of the COVID exposure, that patient has been admitted under respiratory medicine. Now, Scrawl automatically generates the documentation, and it produces a clinical admission note as that what would normally be produced if this was done manually. In terms of general principles, if none of the fields are compulsory, and if you do not complete a field, it will not stop you from progressing, and it will not include that field in the summary notes for the EMR. It allows flexibility, so additional key points can be added through the assessment and plan as needed. And in this situation, we have within the management plans and integrated links to important resources, which may be on the internet as part of a calculated score or a link to an intranet resource within the hospital. This is the dashboard. The dashboard contains a list of the patients that are currently on the platform as being assessed and within the emergency department. The dashboard empowers senior clinicians with a command center-like oversight in the emergency department by using real-time clinical data that enables them to truly understand the patients that are being cared for in their department. By understanding this allows them to provide high-level input into cases in a timely manner, which are being managed by other doctors within the emergency department by having quick access to pertinent information. As the impact of COVID-19 on hospital systems evolves, the platform can be updated so that care reflects the guidelines provided by advising bodies, as well as local feedback and learnings as more patients pass through the door. It can also be customized to reflect local practice, workflows, and resources for each hospital or unit. Scrawl can also integrate into the wider hospital with both respiratory and non-respiratory teams managing care through the platform, so you can get a better understanding of how these patients present and then evolve on the ward, with real-time updates at an individual patient level so you can refine how you manage these cases. For more information, go to scrawlmedical.com. To speak with our team, email info@scrawlmedical.com.